Hello, Facebook. It's me again, Dr. Zarina, also known as Dr. Z. You know me. I am your sports medicine, integrative medicine specialist, here to help you rebound your health through my programs, my medical practice, other products. I am here to help you optimally rebound your health through pain freedom. So that's what I'm here to do, and I want to hopefully bring this conversation to you guys today about cross-training. I get a lot of questions from athletes and non-athletes alike because I often use that term and I kind of discuss it with many of my patients again, and also at different conferences sometimes when I'm speaking or speaking engagements. Some people are just kind of confused about cross-training. What is it? Why should you do it? Should you do it? And what are the possible benefits? And then what are examples of that? So today I want to kind of bullet point a couple of things as it relates to cross-training. Hey, Dr. Lakeisha, thanks for joining me. Mwah! Love you so much. And please do share. Hopefully this information might be beneficial to patients, any patient, quite frankly, or any person out there. This is actually not just for the athletes. Some people think that too. Cross-training, I'm not an athlete or I have to be some kind of do I need to be an elite athlete to be worried about cross-training? Well, actually, no. I'm going to bullet point a couple of those things too as it relates to cross-training can be very effective for people that are not necessarily athletes. You might have osteoarthritis. You might have back pain. You might have knee pain. You may have some issues that, diabetes. You may have hypertension. Cross-training can be very effective and very for helping and treating those elements as well. So let's get straight into it. First of all, what is cross-training? Cross-training, I would say, typically, to make it really kind of plain, is if you're doing basically two or more exercises or types of exercises or that's going to bring about the two goals that needs to be part of that is fitness, improving your fitness level or improving your endurance, as well as improving your performance. And for that piece of it, a lot of course that has to do with my athletes who want to try to improve their performance. They may feel like they're plateaued in their performance, and cross-training can be very, very effective in helping with that. Even if you're not an athlete, again, I want you to hear my voice. This is not just for the athletes. You may say, okay, I'm not an athlete. Maybe I'm a retired social worker, whatever the case may be, and I have some knee pain. Well, that's also still improving your endurance, improving your fitness level. That can actually help as well, okay? So that would be the clear definition, I would say, two or more activities that are with the intention of improving your fitness level, improving your endurance, improving your performance. Okay, so I would say, what are the benefits of that? The benefits is accrues in flexibility. It improves strengthening. It improves your core strengthening. It also can improve your overall health, and as well as in general is going to minimize what we often see a lot of overuse injuries. So for instance, I did have a patient in the office recently, was a runner, and we talked a little bit about that because quite frankly, even my elite athletes forget to cross train, and the cross training is imperative to kind of go beyond that plateau. Hi, Dr. McKee Williams. Thanks for joining me. Please do share, click, and we're just talking about cross training today. Why should you do it? Should you do it? Who is it meant for? Who's it effective for? And we're kind of going over that a little bit. So the first thing, I just kind of defined it. Now I'm talking about some possible possible benefits, okay? Or effective benefits, I should say. So recovery as well. The reason why that's such a big deal, because a lot of I'm going to still speak a little bit about my athletes for a second. You obviously want to perform. You get really focused on the sport that you're doing. I'm a runner. I'm a ball player. I'm a basketball player. I'm a soccer player. And so that's what you train in. But when you forget to go outside the box, so to speak, and train in some other sports like boxing or swimming or rollerblading, when you don't do that, you can put yourself at risk for overuse injuries because you're repeatedly using the same muscles over and over again, trying to maximize your performance level with the, say that soccer in particular, when if you don't go outside of that, there's certain muscle groups that you're not using readily because you are focused on certain muscle groups that are always going to be used for that particular sport that you're in. And those other muscles are weaker than the ones that you're constantly using. Hence, you're going to have this imbalance. That's actually true for, again, even my non-athletes. You may just have a rhythm or a pattern of your life. I would use it as my truck drivers, for example. You do the same thing day in and day out. really there's a lot, very sedentary lifestyle, quite frankly. If you're my truck driver, listen to me. And it's imperative that you cross train as well, so that you're using different muscles that you typically are not using, so that you still can build the strength and endurance and make sure you're keeping yourself out of risk for injury. Or if you already have an injury, you might say, well, I already have an injury. Should I still cross train if I had an injury? I will put a disclaimer and say, never start an exercise regimen, a new routine without consulting your physician, because everybody is uniquely different. And you want to make sure that there's no contraindications, or layman's terms would be any reason that you should not be doing it, okay? But this is some general information that in general, yes, cross training can be effective even if you have a back injury currently or knee injury. It can be a crucial part of your recovery, your overall recovery. If it's a new injury, we don't say, okay, you just got hurt, go out there and cross train. No, this conversation is really about that recovery stage. Once you're in that phase of the recovery, that you're kind of past the acute stage and you're trying to get better. You say you have knee arthritis, for example, that cross training can help different kinds, such as yoga, for example, if you that can improve your flexibility. Which, if you improve your flexibility, if you have arthritis in those joints, then that's going to decrease the stiffness. And you probably know, those of you out there that have arthritis, one of the common complaints or the common issues that you have often is, thanks, Jamila, thanks for joining us, is stiffness. When you first get up to move and you first want to stand up and those joints that feel a little crickety, then one of those issues is a lack of flexibility. We want to improve that. Okay. So we talked about flexibility. We talked about strengthening, how cross training can help with that, will help with endurance, help with flexibility, help with recovery. So if you've been overdoing certain sports or certain type of exercises over and over and over again, if you kind of come out the box and say you're a runner and you start doing a little bit of swimming, that is a part of recovery, kind of giving your muscles a little rest while still keeping up your endurance, because it allows you to rest at certain muscle groups that you're always using when you're running, and instead you can use a little bit more of the upper body for swimming, for example, right? You're also improving your cardiovascular, right? Because it's an aerobic exercise. And then also, you're going to be improving your strengthening for the core. One caveat I would say with swimming is that sometimes with rotator cuff injuries, that might be an issue. So you want to kind of maybe, be a little bit cautious about that. And again, consult your physician. If you're thinking about, I want to cross train, I want to get into X, Y, Z. Hi, Dr. Kwanzaa. Thanks for joining me. Thanks for joining me. Please do share. If you would like to, hopefully this can be very beneficial for someone that you may this earshot. So yes, as far as swimming is concerned, that can be very, very effective, okay, for our runners as well. Coming outside of that, you're going to use some other muscle groups that you typically aren't using necessarily when you're running. Kickboxing, I like that one as well, because again, you're going to use some hip stabilizers that you critical actually for your performance, if you will, when you're trying to improve your performance. So that's going to be critical as well, okay? And we talked about endurance. So those are the kind of the big five. Let's say endurance, recovery, flexibility, strengthening, and core. Those are the five I would say that are going to be very effective when it comes to cross training. And I don't care if you're an athlete or non-athlete, that can be very, very effective, and cross training provides you with that if you're doing it correctly. Okay, so some other examples of it. An would be, there's different ways to go about cross training. You can do cross training over a course of a week. And that example might be you do you do an exercise each day. So Monday you might do yoga. Tuesday you might do weight training, preferably bands. I'm not a fan of free weights, but you might do band or strengthening. The third day, Wednesday, you might decide to do kickboxing, so on and so forth. So you're switching it up a little bit, all right? That's what I mean about cross training through the week. Another way of doing cross training might be in the same day. I'm a big fan of saying and letting people know 15 minutes a day, you can get a lot of impact and do a lot of improvement in your health if you give yourself at least 15 minutes a day. And I'm a firm believer, everybody got 15 minutes, right? No matter how busy you are, got to give yourself at least that. How do you do that? Well, that may make you make it up in 5 intervals, 3 5-minute intervals. So for 5 minutes, you might do yoga, but intense yoga where you're really focusing on your form. Hi, everybody. Thanks for joining me. One of the questions, let me get to that real quick. Water aerobics might be good during pregnancy. That could be effective, definitely. It's very gentle on the joints. as well as just creating that buoyancy. So that is a good point and question. Again, consult with your physician, consult with your OBGYN before you initiate any of that, but that can be effective. What was I? 5 minutes, 5 minutes, 5 minutes, exactly. So that was where I was about another example of how you could cross-train. So you might say, I might not do it, throughout the whole week, but I want to do it in bursts. So say you gave yourself 5